Okay, so finishing up Chapter 6 with Part 2. In Part 1, we talked about acute and chronic conditions, rule and ruled out, borderline diagnoses. Now let's talk about a threatened or an impending condition. And what you're going to need to do is review that record to determine if that condition actually existed or actually occurred. And if it occurred, you're going to code it as if it is confirmed. However, if it did not occur, or a related condition did not occur, you're going to want to take your direction from the alphabetical index. Turn to the main term, threatened or impending, and look for your condition there. The other thing you can do is take a look at the actual condition and look for the words threatened or impending and see if there is a code assignment there. If that condition is not sequenced as threatened or impending, you're not going to code a code. Each diagnosis code in ICD-9 is only reported once per encounter, and this applies to bilateral conditions or to two different conditions that are classified to the same diagnosis code. And that's one of the struggles with the ICD-9 system, is there is no easy way to identify that a condition has occurred more than once or at two different levels or two different sites. So you need to be really, really careful. Do make sure that if you have a bilateral condition, when you're going through the main terms, look for a subterm bilateral, because in some instances that is present. So let's talk about late effects. When coding late effects, you're going to want to turn to the main term late and the subterm effects in the alphabetical index in Volume 2. ICD-9-CM only provides a limited number of codes that indicate the cause of a late effect. It's important to remember that in ICD-9, late effects require two codes to fully describe the conditions when the following criteria is documented, and they must be sequenced in a very specific order. So, residual conditions, or the nature of the late effect, is sequenced first. You will know the result or the residual, okay? So it's what is hanging out after the acute phase has been resolved. Then you're going to want to code the cause of the late effect. And this is that second code that a lot of people miss. We want to show what was the reason for that original or the residual. If the late effect is due to an injury, you're also going to want to assign a late effect E code. There are some exceptions to when two codes are required, and we're going to talk about those real briefly. The first one is when the residual effect is not stated. We may want to use the cause effect code alone to show that an individual had a previous condition that is affecting care. When there is no late effect code provided, but the condition is described as being a late effect, and you only know the residual. So we know that they have a current condition, we just don't know specifically what the effect is or what it was affected by. And then the last one is when the late effect code has been expanded to the fourth or fifth digit to include the residual condition. An example of that is in the category 438 for late effect of cerebrovascular disease. That is a combination code that allows us to identify an individual has a residual such as hemiplegia or dysphagia or aphasia as a result of a late effect. You would not usually use a late effect code with a current illness or injury of the same type. Okay, so be very, very careful with that. One exception here again is with the CVAs. It is very possible for an individual to have had a CVA several years ago and to have hemiplegia and to have a new subsequent CVA. So in that instance, you would have a late effect and a current code. So be very careful with that.